It's the 61st day of quarantine in Iquitos, Peru. Iquitos is part of the Loreto region, largely known as being the hub of ayahuasca tourism, and has been severely hit by the coronavirus, suffering one of the highest mortality rates across the country. I'm joined by Emily Sinclair, a writer based out of Iquitos who's been studying the development of ayahuasca shamanism as an anthropologist and advocating for safe and responsible practices as a member of Chacruna's Ayahuasca Community Committee. She just wrote an article for Chacruna sharing the impact the virus has had on the region and has also launched a crowdfunding campaign to support the local people in this great time of need. Great to have you here, Emily.
Yeah, lovely to be here.
On March 16th, strict measures were taken to put Iquitos under lockdown. Can you share what happened in Iquitos and at the ayahuasca centers in the nearby regions?
So since the quarantine came into effect, everything has been shut down, including tourism centres here. We have banks, pharmacies, and basic food stores open, a curfew from 4 p.m. till 4 a.m. The government brought in bonuses to help people with supplies, to help people with money to get through this period. And that, although it may have been well intentioned and people need this help, what it means is that people are queuing for hours and hours in the streets every day to go and collect their bonuses, and sometimes not managing to, having to stay over in the city. Many people live in remote areas here and aren't actually able to travel in easily to do that. And so we know people who have been waiting for 3 weeks to collect them, and others who just simply don't have access because they don't have a citizenship card, like some Shipibo communities here. Added to this, Iquitos is a really remote part of the world. We're the largest city in the world not reachable by road. And you know, it's a city in the middle of the Amazon jungle. So there's a huge amount of pressure on supplies here. And supplies, both food and medical supplies, are seriously dwindling. I would say that the effect of the quarantine measures and the lack of resources available to people here is as devastating, if not more, as the virus itself.
How did the lockdown impact the locals and communities that work around the centers?
There's a lot of people here that are dependent on ayahuasca tourism and tourism more generally, jungle tourism. It's a huge part of the economy here. So certainly a lot of people just lost their jobs. They don't necessarily get supported. It depends on the centres. And also on top of that, there's a lot of people who don't work in centres, but they are artisanias, Shipibo artisanias selling textiles, you know, other artisanias selling jewelry. This is a huge ayahuasca related trade here. We were contacted by a guy called Kevin from the Kukama tribe, who work usually with a centre in the region. So this is actually where it's an ayahuasca centre, quite a famous one in the nearby region, and they usually make all their money from liaising with the tourists there, selling artisania. Some of them just work, you know, as labourers in the ayahuasca centre. And so because the centre's closed, he's telling us they have nothing, and he was saying, you know, he feels they've been forgotten, they've got no support from government, they've got no support, they've got no work, and they're basically just left without anything. This is the truth. The other problem is a lot of Indigenous people who are in the city want to, of course, go back to their home communities. So Indigenous people who need to be in the city in order to work, then going back to their communities when the quarantine measures came in, and therefore ending up spreading the virus to their communities, which is especially dangerous for Indigenous people because, first of all, they're more vulnerable in terms of their immunology. And so, you know, they don't have the immune system necessarily to cope with it as well as Western people, outsiders. And also because they don't have access to supplies, including medical supplies, as much as people who are in more urbanized areas. So the effect on the Indigenous people in the region is, yeah, pretty terrible, really, pretty dire.
In your article, you mentioned tensions between local communities and the retreat centers around how the centers attract foreigners who might have carried the virus in. Can you tell us a little more about that? There seems to be definitely a little bit of history repeating itself, as you put it in your article. These anti-gringo sentiments harken back to the rapid spread of illnesses brought by invaders since the colonial era.
I've heard reports from a few people who work at the centres actually that they were feeling anti-gringo sentiments. And yes, it's just simply the association of this disease with the Western world, the outside world. And of course, understandably, there's a huge history here of pandemics brought by Western people, brought by, in the colonial era, that wiped out many indigenous people here. So that fear is understandable and perhaps warranted, really. However, there's also, in general, actually very good feeling between gringos and local people here. So this, this was, I'd say, a rarity. Actually, most of the local people, certainly that I ever come across, are very welcoming towards Western people. They are in mutually beneficial relationships, actually, in general.
So can you tell me what's happening at the centers now? Are there any retreat centers that are continuing to hold ceremonies despite the lockdown, even underground?
So in general, the centres are shut, and there's been actual announcements by some of the larger centres that they'll be shut for at least 6 months. And some of them are doing campaigns actually to help their workers, help communities that they're connected to, which is great to see. But yeah, generally there is a total shutdown of all ayahuasca retreat centres for certain. And the truth is that looks like it'll be that way for the next year or so, I would say, until the end of the year, probably.
So you've launched a crowdfunding campaign to raise money for people in need and support. Can you tell us a little bit about that?
Yeah, so me, my partner and I have, and a friend who's working with us, have launched this campaign to provide supplies to people who are suffering most during this time. Generally, the people that we're most connected to through ayahuasca work and medicine work. So that includes Shipibo communities, artisanias, shamans that we've worked with, curanderos in the region, who are generally dependent on Western tourism here, and some of whom do not have access to government aid. So basically what we're doing is raising money to buy supplies for families and individuals in the region. And we're delivering those supplies as we get the money in. And with the help as well of a local mini mart who are working really hard with us to get enough supplies to fill the boxes and get them out there. So far we've helped about 100 families, including 70 Shipibo families, 73 Shipibo families. So it's just a way to try and do something to give back to these people and this place.
Wonderful, Emily. Thank you so much for joining us.
Thank you so much for having me. It's been a pleasure. And if anyone is interested in supporting our fund, it's called the COVID-19 Iquitos Relief Fund. It's through GoFundMe, and we're aiming now to raise £15,000 to continue the support that we're giving here. Thank you.
Great. Thank you.